Well, for as long as I can remember, I have always been hungry. I remember when I was probably 5 or 6 years old, there used to be a commercial on TV about a little boy who was swimming in a sea of chocolate, and I couldn't imagine anything better. We do have a history of obesity in our family. My grandmother and my aunts on my maternal side, and also on my paternal side, lots of health concerns related to diabetes and heart disease that are a product of the obesity. I went to a medical conference in 2016, and for the first time I learned that obesity was actually a disease. I had never heard that before. Too many people believe that you should be able to manage this yourself. Self-discipline, willpower is going to be the way to do it. But nobody says that about wearing glasses. They don't say, just squint, They say, of course, wear glasses. Why do we have to attach a moral stigma to this? There's no morality to a disease. And I finally decided to speak to the doctor. He thought that if I got up earlier, and he was a swimmer, so he said, just get up an hour earlier and exercise in the morning, and that will be a big help. I went out and walked, 3 miles every morning for a while, and it didn't do anything for me, and I wasn't successful. But then a year later, I went back to the doctor for my annual physical, and at that time, he had learned about a treatment that he felt that he could get behind. I was excited to be able to start making a difference that would ultimately end up allowing me to manage my weight. I think that it's really important for healthcare providers to listen and be receptive to their patients, and also to be proactive and bring the subject up. I think a lot of times patients are afraid to bring up a subject about how to treat obesity because they're ashamed. But if their healthcare provider can bring it up in a non-threatening, non-judgmental way and say, hey, there are options if this is something you'd like to talk to me about, that we can walk this walk together, I think that would be a great improvement in patient-doctor relationships.